our next presentation, which I think builds nicely off of the conversation that we all just had. We're going to be hearing from 3 individuals from Los Angeles, and they're going to be telling us about their exciting efforts to respond to some of the issues that you've heard about today, and their efforts to truly re-envision what care and safety can and should look like in healthcare settings. If my panel wouldn't mind now muting their videos, and then Vince, Shamsher, and Hannah, you all can unmute your videos. Vince Chong is a health sciences assistant clinical professor of surgery at Harbor UCLA. He's also the co-lead for Safe Harbor, the trauma center's hospital-based violence intervention program. Shamsher is an assistant professor of emergency medicine at Harbor UCLA, where he helps co-lead the hospital-based violence intervention program. He is also the former medical director of the Whole Person Care Reentry Program and an active member of the Frontline Wellness Network. And finally, Hannah Janeway is an emergency physician in Los Angeles and a member and organizer for Frontline Wellness. Besides working towards re-envisioning healthcare spaces free from carceral forces and systems, they are also the co-founder and co-director of Refugee Health Alliance. Thank you all so much for being here, and you all can take it away.
Great, thank you so much. Let me just share my screen. Okay, so today we're going to talk to you guys a little bit about what we learned in Los Angeles through the organizing that we've been doing. And this is the title of our talk. I think this kind of accurately portrays the breadth of the work that we've been doing, working in partnership with the community to try to re-envision healthcare spaces so that hospitals truly become centers of care for the people who should own them, which are the patients. You know, a lot of us, Shamsher, Vince, and I have worked in the county healthcare system, and you know, county hospitals are supposed to be hospitals that are refuges and safe havens for everyone in the community. They're funded by the public. And so how do we create hospitals that actually are in line with the vision that people in our community have for healthcare spaces? So I'm going to tell you a little bit about how I kind of got into this work, and I think some of the other individuals who we work with got into this work. And it takes us back to December of 2015 when Ruben Herrera was murdered by a police officer in Harbor UCLA. And at that time, I was actually working in the emergency department, and I saw the event. I tried to do a lot of organizing around it in the hospital and with my colleagues and coworkers, which at that time wasn't very successful. It was kind of just seen as too controversial to be working on this issue, and I was told a lot that I should just stay in my lane and the police were our colleagues, and that it was unfortunate that this individual died, but you know, we need to move on. At that time, when we were organizing, as me and some other residents, we tried to force the hospital or the police system to try to make some changes. And as I'm going to talk about a little bit while later, not many changes were actually made. Actually, it was never reported as a safety event. It was never a root cause analysis. And the true number of substantial changes that happened in the hospital were quite minimal. And I think I personally learned a lot about that, about the limitations of just working inside the hospital setting alone without kind of spreading the reach out and organizing with other individuals who've been doing this work for a lot longer than I have. So we get there to November of 2020, same hospital, very similar thing, police officer murders another person in the middle of a mental health crisis. Nicolas Burgos in a coma for a long time, now deceased. And the question is, you know, why does this keep happening and how can we prevent it from happening in the future? And even much bigger than that, right? Because we're seeing all around Los Angeles County, it's not just in hospitals, it's a lot of people for a long time have been calling out for a change to how we think about how we uphold and provide health. And what is our responsibility as healthcare providers? What is our responsibility as community members to change the way that we think about these things and really work within a system that promotes health instead of unhealth in the community? I'm going to pass it over to Vince now.
Thanks, Hannah. So like Hannah was saying, you know, this is a second event in our hospital. And so we sort of understood that Making change is going to take a lot of different steps, and sort of a multi-pronged effort. And I think Hannah and Shamshir will talk a little bit more about the Frontline Wellness Network and the work they've been doing in the community. But we recognize that sort of there's a small step that we can try within the hospital to engage our administration and engage the stakeholders within the hospital in making some incremental changes. Some of the things, this was actually backed by the Frontline Wellness Network in a little bit, but also by our resident union. But some of the things that we tried to get across were de-escalation training for folks who are going to be responding to situations in which patients may be putting themselves or other staff or other patients in harm. We call this a code gold. And so we have policies in place in the hospital to make sure that law enforcement that's there, just like in other county hospitals, our law enforcement are actually integrated into our hospital system with our security force. So they're there all the time. But in trying to enact these policies, they make sure that these cold gold teams are put together in a way that law enforcement doesn't actually have a front and center role in working with patients who are in a mental health crisis. A hospital policy task force was actually put together by our administration to look at some of the policies that we have in place. I will say that part of the cultural problem with, I think, a lot of healthcare systems is that we have these policies that are put into place, but enacting them and making sure that they're followed as written is very difficult, particularly in a culture where I think people have alluded to that there's this idea that the law enforcement are in our hospital to keep us safe. And so part of the problem in figuring out how to make sure these policy task forces, the policies are actually followed, is going against the grain of the hospital culture and our staff. There's a lot of cultural deference to law enforcement as authority in our hospital, rather than making sure that, like Hannah said, we're putting patients first and making sure that we're putting their best needs forward and keeping everybody safe. But those are some of the hospital-based organizing that happened as a result of the November 2020 shooting. But I think Shamshir and Hannah are going to talk a little bit more about a community-led effort to make sure that this isn't the end-all, be-all of the organizing that happens around this issue.
Shamshir?
Yep. Oh, I thought you were taking this slide, Hannah. Yeah, so to Hannah and Vince's point, there was a recognition that, some of the limitations, whether it's through politics or the bureaucracy or whatever else it may be, might constrain, what was possible. So we were able to engage a lot of ongoing organizing in the community to work with, those who had been affected, the family members of those who had been killed in the hospital, to incorporate them in the organizing efforts, to have them elevate their voice, the experience, the humanity of those individuals that were affected by the status quo, whether or not it was a result of the policies that were in place, the lack of enforcement of policies, whatever else it may be. And this was a very important thing, I think, because oftentimes our healthcare settings and venues don't center or elevate these voices, or oftentimes the community, to Hannah's point, isn't. They own the hospitals. These are the hospitals that are there to serve them. They're not at the table in having these conversations. So a lot of the members of this organization we work with, Frontline Wellness, which I'll get into, were very active in reaching out to the families. And the families were incredibly appreciative of being a part of these conversations, these protests, and have continued to remain engaged both around conversations about hospital policies, but then broader conversations about policing in the county and beyond. And one of the other things that came out of these conversations was that a lot of times we discuss amongst ourselves what needs to change. We talk with policymakers, but similar to work that happens kind of in the immigration world about know your rights. In this case, oftentimes we don't know what patients' rights are, but as we start to learn, what are patients' rights, what are violations of patients' rights, what are violations of privacy, we need to be working with community and families so that they understand that they can spread the word amongst themselves and be able to advocate for themselves when those rights are violated. So we've started to build some of the scaffolding for that. If we go to the next slide, I think a big Another thing that really changed over the course of the 5 years between those events was a lot of organizing that happened around the county around jail construction. And I think what it forced us to recognize is that we have to work at, at the individual level, at the institutional level, but really what we have to do is ally with community organizing and social movements to address some of the structural conditions that led these events to happen. Oftentimes what happens in these conversations is that regardless of where you're coming from, people recognize the status quo is extremely problematic, but then, a variety of things will come up because of X, Y, or Z constraint. We can't make any significant or drastic changes, even though that's what we need. But what's often absent from those conversations is that X, Y, and Z constraint is a product of, decades of policies that have promoted mass incarceration in this country, decades of policy that have expanded the purview of what police are expected to do, and decades of policy that have cut funding and support for services that we need to mitigate, the role of law enforcement in care settings or to remove law enforcement from care settings altogether. In LA County, just to give a little brief history, we have, and you can't really talk about policing in hospitals without talking about kind of mass incarceration, and you can't talk about policing in emergency departments in LA without, acknowledging that LA has the, if not the largest jail system and quote unquote the largest mental health institution in the entire country. And policing the community and policing in emergency departments is an extension of that. Back in 2015, there was an analysis done which projected that the number of folks with serious mental illness in the jails, people with multiple chronic medical conditions, was expected to drastically increase. The response was, very ironically and unfortunately, that we need to build a mental health jail or a medically, focused jail. And this really triggered community to organize under the umbrella of Justice LA to say, this is absurd. And they came up with a very succinct and but brilliant tagline of care not cages, really to rebut this idea that we're going to use health to justify the expansion of policing and incarceration. And if we go to the next slide, one of the things that came out of Justice LA was an organization that we're a part of called Frontline Wellness Network, which brought together healthcare providers to articulate what is this alternative, what does community-based systems of care actually look like. Instead of spending $4 billion on building new jails, how can we better spend it to create safety in our communities, to create systems of mental health care, of systems of treatment for addiction, et cetera. So we were all kind of part of this organization focused on decarceration efforts, and we're very successful, in the stoppage of the jail construction, also in the closure of one of the existing jails. But when this event happened at Harbor, it really forced us to recognize that, the carceral system doesn't end at the walls of the jail. It extends into the community and into our emergency departments. And it brought that body of people in alignment with this work that's happening at the hospital. But then what it also did was for people who were organizing and, very angry and rightfully so about what had happened in the hospital, it provided this larger frame that, there is all this work, there is all this momentum in a positive direction that's happening, that we don't have to work only within these constraints. We can have bigger asks. We can kind of reset the terms of, what we're fighting for. And I think that really led to some of the work that we're engaged in now that Hannah's going to speak to.
Yeah, I think what Shamshar was talking about was really vital, just because I think having this framework and incorporating it into a much larger sort of movement that is towards health promotion instead of towards carceral systems allowed us to figure out how to create the type of change that we wanted to. And so as you can see, like while I kind of started, many years ago at the hospital system, we started working with these local organizations. Frontline Wellness really took charge, and we started making demands of the Board of Supervisors, who are elected officials and actually in charge of our healthcare system, that is the county healthcare system. And part of that has been to really tackle the thing that funds all of these things, which is, the budget to DHS and the way in which the sheriffs are funded. The sheriffs are currently funded through money that the Board of Supervisors gives to DHS, who then basically contracts with the sheriffs and then also contracts with some private security, who are the people actually at the doors of our hospitals. And so trying to pressure the Board of Supervisors to basically force DHS to kind of rethink the way in which we were thinking about hospital safety, providing health care, and really caring for our patients was extremely important. And just to highlight some of these things, the first thing that we did, and these are just practical things just in case anyone's thinking about how they might work in their own system. Every system is different, but one of the first things we did was create this huge document where we kind of listed our demands and talked about the current policies. And we presented that to the Board of Supervisors. First, that involved a lot of background meetings with the Board of Supervisors, with the Civilian Oversight Commission, and then that led to us having specific policy demands, which you can see right here. And as Shamshir said, allowing us to work sort of in this community activism framework with people who were already pushing for this allowed us to ask for much larger things than we could have if we were working just inside of the hospital setting. And so talking about, basically taking away the sheriff's substations, reviewing and revising all policies, funding new sort of community safety and crisis responses, because the reality is the contract with the police or the sheriff's substations was a $30 million contract. And with $30 million, you can do a lot of other things that are pro-health and still create safety within the hospital. So these were kind of our policy demands to start with. We also worked with legal experts like the ACLU, as well as an independent legal expert who was on one of the other panels, is going to be on one of the panels, Ji-Soon Sung, who basically put together a legal analysis saying everything that we're asking for is totally legal and actually is better for the county than the current sort of system and policies. And I just want to say, DHS did kind of respond and put together a proposal. We had asked the Board of Supervisors to ask them to kind of put in policy recommendations that are different than the current ones. And some of, they did kind of meet us halfway. One of the things that they said is that they were going to move sheriffs to the periphery of hospitals, so not to have the police station right in the middle of the hospital. We don't think that's far enough. Any police presence around a hospital is a deterrent, like one of the last speakers talked about. They also asked for revision of policies, but unfortunately, a lot of those policies that they were talking about were really vague. And while the Harbor Task Force tried to do some things to make it better, what it actually did was more tightly ingrain police into the care system at Harbor instead of really kind of trying to re-envision what could happen inside of that hospital. And that's partly because, these hospitals are constrained. And so part of what we were doing is asking, to have more participation from the community and have more stakeholder engagement, which simply was not present in the Harbor UCLA task force. The other thing we learned is that collaboration is super key. As you've heard from other people who talked before us, people are using different strategies all around the country. We ended up realizing that working with families was really helpful because when families went to seek justice, they would ask us, what can we do? What kind of demands can we make to create change in the hospital system? Because we don't, we're not just in this for money, we're in this to create change. And so working with them was really, really helpful. We have spoken a lot with DPH Must Divest and gotten hints and tips from them on their successes. And there's also a network called Cops Out of Care Spaces, which is doing sort of a national-wide organizing campaign, bringing people together to work on this issue collectively. And you can look them up online and get involved if you want to do that as well. I think that's it. I don't know if Shamshir or Vince have anything else to add.
Thank you guys so much for sharing. That was really, really powerful. And you did a great job of inspiring everyone on the panel to show us that our responsibility to our patients and our communities really goes beyond just the individual in front of us, and it includes shaping policies of the institutions and cities in which we practice. So thank you guys so much. It was really great to hear from you.